Please welcome our next guest, Dr. Jeffrey Beecher. Dr. Beecher, thank you so much for coming today. I know how busy you are, and I really appreciate your time.
My pleasure, absolutely.
It looks like you've been working already, so I won't drag this on too long for you. So tell me a little bit about your background. Where did you grow up, and where did you go to medical school?
I'm from Des Moines, Iowa.
Really?
And born and raised there my whole life until went off to college. Undergrad was at Miami of Ohio, and then I went to medical school at Toro, Nevada.
I'm from Ohio.
Oh, okay. Yeah, very nice.
Originally, yeah. Well, what drew you to neurosurgery?
When I was at Miami of Ohio, I took I was in an advanced biopsych course, and we were doing brain dissection, and I realized that my passion was actually brain anatomy and surgical aspects of the brain rather than the kind of physiology and psychiatric components of it. And so I totally changed directions, and that was that. I never looked back.
Really? Oh, that's amazing. That's a great story. You not only have one fellowship, you have two. Is that correct?
That's correct.
And what are they, other than the brain surgery?
Yeah. So my first fellowship was at UT Southwestern in Dallas, Texas, where I trained with one of the world's most renowned neurosurgeons for open cerebrovascular neurosurgery, which is blood vessel problems of the brain and spine. So we're talking about like brain aneurysms, something called brain AVMs, which is truly like a ball of worms in the brain, and other blood vessel problems. And then my second fellowship was at Buffalo, at University of Buffalo, where it's probably the world's most well-regarded place for endovascular neurosurgery. And I was very fortunate to be there with some of the really big names in stroke rescue and minimally invasive treatments for brain aneurysms and other diseases of the brain and spine.
So how long have you been here in Wilmington or at New Hanover Regional Medical Center?
4 years now, just over 4 years.
Yeah.
Yeah, it's gone by quick.
Yeah, I know you were on the show early on. You hadn't been here too long when you were on our show before.
Yeah.
So. I know that Novant Health New Hanover Regional Medical Center is one of the few facilities that has a 24/7 neuro, I have to get this right, interventional coverage to treat patients with neuro or cerebrovascular emergencies. That is a mouthful.
Yeah.
So why is that so important?
Well, it's really important because these are time-sensitive illnesses, meaning when somebody has a stroke, every second counts. When somebody has a brain aneurysm rupture, every second counts. So it's really important to have an institution like this that can do 365 days out of the year, 24/7 coverage to intervene on these problems when they occur, because there's a phrase we like to use, time is brain.
Oh.
And so the faster you get to us and the faster we get everything back to normal and opened up, the better outcome the patient most likely is going to have.
Well, tell me a little bit about that process. What if the patient is in Brunswick County? How does that happen as quickly as possible? I know AirLink and
Vitalink, yeah.
Vitalink.
They are amazing. And
I know
I
they
can't
are.
tell you enough. I can't talk about them enough. They were here before I got here, so I can't even take credit for what they do at all. I wish I could, because they're amazing at what they do, and they get the patients to us so fast that it makes it so that our job and what we do is effective, and we are very appreciative of them, and our community is lucky to have them.
So they would typically pick them up at Brunswick Medical Center. The patient would initially be transported to Novant Health Brunswick Medical Center, and AirLink is stationed there 24/7 now.
Yeah. So what's really cool is that we have what's this artificial intelligence program called Viz-IA.
Yes, I want to ask about that.
Yes. So when Brunswick, Novant Brunswick has a stroke patient they're concerned about, they activate their process, and the patient gets a special CAT scan with contrast that shows us the blood vessels, and it goes straight to my phone.
Oh,
I don't have to wait for a radiologist to read it or anything else. The ER doc doesn't even have to call me. I get the image right away, and I'm telling them, just like this morning, one came through and I said, all clean, doesn't, nothing that I need to intervene on. And the ER doctor, gave me the thumbs up and said thanks, and then told me the story of the patient, and it looked like something that could be handled there. And just the other day, we had the exact opposite, where it was like, we have a problem, this needs to come, and Vitalink, AirLink brought them right over, and we took care of it.
Yeah. I think we talked about when you were on the show last time, we talked about those protocols that are in place now and how you've worked with the emergency departments in the area and how everybody's on the same page, so to speak.
Yeah, we've done our best to get out to every ER that we can and to all the different systems and just to make sure that our protocols that we like to embrace in our system, because we're very proud of our system's pathway, we're trying to bring that out everywhere else so they can mimic what we do and get patients to us as fast as possible.
Well, talk to us a little bit about NHRMC's 17th Street campus Neuro Tower.
Yes, well, this is something we're very excited about, very excited about. And we are going to be blessed with a tower that is dedicated to neurosciences and neurosurgery. So we're going to have dedicated neuro ORs with 2 dedicated neuro biplanes, which is where we treat stroke and brain aneurysms. And it's going to just bring what's already an amazing neurosurgical team up to another level. The neurosurgical care that we already provide is tremendous. I mean, we have some of the best robotic spine surgeons in the world. We have some of the best minimally invasive lateral access surgeons in the world. And we have excellent, excellent complex spine surgery. And I'd like to say that we have excellent skull-based brain tumor surgery, because that's my forte as well, as cerebrovascular disease. And we already are at this very high level, but this is going to make it so all the other systems and doctors and teams that are ancillary to neurosurgery have a home. So we can really bring neuro care to another level that's just never been experienced in this region.
Right. You mentioned other types of brain surgery. So I'm curious, we've talked a little bit about stroke, but tell me about some of the other procedures that you do.
Yeah, so there's brain tumors, which obviously, unfortunately, we have to deal with, and patients get those. But we also have brain tumors that are very complex, and we call those skull-based brain tumors. And so these are tumors that are located in a very, very challenging location in the brain at the bottom of the skull. And in Dallas, when I did my first fellowship, it was also in becoming an expert in getting to these hard-to-reach places in a very safe and efficient manner. And so we are really proud to have this skull-based program here where we can treat these really complex brain tumors that typically couldn't be treated in this region. And now our brain tumor program has just gone through the roof and totally changed the amount of patients we're able to reach, and certainly giving our community the ability to keep patients here instead of having to go elsewhere.
Well, there's so many different procedures and what have you. How many neurosurgeons do we have here at New Hanover Regional Medical Center?
There's 6 of us. We actually just merged into one team. And so there's 6 neurosurgeons that completely cover each other and work together. And really blessed to have Doctors Alcina, Meelan, Huffman, Thomas, and Brown, as well as myself here, and I'm very proud of our product.
That's awesome. I also believe you all have your own assistants, your own practitioners.
Yes, we each have a PA that works directly with us. That is an excellent extension of us and really makes it so we can be in 2 places at one time.
Yeah, and it makes it, I think, more comfortable when you have a buddy, when you have a partner.
Absolutely,
there.
absolutely.
Was there anything that you would like to add before we close in terms of neurological signs and symptoms?
Sure, absolutely. So with regards to stroke and brain aneurysms, the thing that most people just need to understand and remember is that if something's off, the answer is never to go sleep it off. If you have weakness or numbness or tingling that's just not right, you got to get to the ER.
Well, thank you so much for being here. Thank you for what you do, and I can't wait till the tower opens because you're going to come back as my guest.
Oh, excellent. I'll be there. Thank you.
Thank you.